Hello, good evening. How are you day? Welcome to another session of Ask the Doctors. This program now every Sunday by 8 p.m. West African time. I be the host, and my name now Frederick Unwigbohai. My co-host now Dr. Israel Irobonose. And we'd always do online like this every Sunday to the answer questions, to the teach. And today's program, today, na question and answer session. Now, for those who just they watch me for the very first time, in case we get anybody who they watch me for the very first time, you do welcome. And for those who watch us after we don't end, sorry, we not go to respond to you if we don't end this live session, and you do watch us when we don't end. So, those who they watch for the very first time, you do welcome. Here, na educational page, we they teach, we know they prescribe medicines, and we know they do diagnosis online. So we they happy to have you join us. And for everybody where they watch me, where are you watching me from? Oh yeah, tell me. Ngozi, good evening. Ngozi, how are you? Good evening. Evie Ehis, I see you. Evie, how far evening? I did fine, oh, I just did. Ngozi watching from Germany. Now so. How is Germany? How that side? How Germany day? How Germany day? So today, na question and answer session. I see you. Jessica, I see you. Chima, I see you. Who they here again? Deborah Bolanle, Manuel Du, Femi Stone, Alpha. I salute you. How you day? How you day? Good. Welcome. Good evening, everybody. It's great having you here tonight. So if you get questions, feel free, ask your questions, drop them in the comment sections. So today now open day, and I dey expect Dr. Israel. Okay, I did fine. Esther Samuel, Esther, good evening. Glory Udofia, watching from Italy. Jessica, now so. Okay, oh yeah, share the live. Share. Make we share and invite your friends. If you just dey enter, okay, you're watching from Italy. If you just dey enter, no be say you go just enter like this, you go just start to the bombard us. At least say hello to the people in the house. And Chizoba is watching us on YouTube. Okay. I see you. Let's take this question here. This person talk say, what are things that cause eye weakness? Look, your question no dey clear, because normally eye no supposed to be weak. But one thing if you make somebody get eye weakness, age. So when you say eye weakness, what do you mean exactly? Huh? Good. Oh yeah, drop your comment, click on the like button and share. When you share, comment shared. Oh yeah. Can exercise heal knee pain? The answer is yes and no. What do you mean, Bolanle Deborah? The answer is a yes and a no, because if you don't know what they cause your knee pain, you just go the exercise, you might worsen the pain. Some people go get knee pain, it will be because of their weight. They will tell them, try to reduce your weight. Do you understand? So um the advice for somebody will get knee pain now to know what they cause that knee pain, and then when you don't know the cause, you go come tell the person what to do. So and if you just tell you say yes, exercise will cure knee pain, and then you go the exercise, the knee pain will come worse. You can't blame me. Okay, share the video. Please help reshare video of low blood pressure. Vitalis, okay, I will try to do that when I'm done. Watching from Nasarawa. I'm watching from Taraba. Chima, Taraba, Femi, Nasarawa. Okay, hope you are cool. I'm cool. I have shared. Femi, thank you for sharing. Who else don't share? Let's see. Chizoba from Germany. Please, having regularly is for my system. Femi, your question is not complete. Your question no complete. Oh yeah, make una share. We don't dey live this night though. After we don't finish live session, people go come they ask me questions on that video. Doctor, answer me now. Answer me. How I want to answer you? Eh? I know they sleep online. Why make we dey come online like this? But when we come online, people no go join to ask questions. Now when we don't finish, the last time they won't come they insult. You chef, you know answer. They do like this. Hey, okay. So please, Bolanle, yeah. Kadiri from Edo State. Oluwa Sheun, how are you? How are you? Doris Divine, I see you watching from Belgium. Gloria is watching from Belgium. Now women full here pass. All the men no go come. They go one come they enter your inbox. Okay. Let's take this question here from Kenneth. It says, "Good evening. My question that I have experienced stomach and waist pain for over a month. And take many antibiotics, it wouldn't stop. Please, what is the cause?" Kenneth, I have shared with 20 people. God bless you. God will bless you. God will bless you. Thank you. The rest people no one share. So, who gave you antibiotics? That is number one. Number two, abdominal pain and waist pain. There are different things that might be causing it. And there are many things that can cause you abdominal pain. So I don't know why you go to drink antibiotics. Who prescribe them for you? That is my question. And then there is no way. Listen, there is no way on social media. I can tell you what is causing your waist pain and your abdominal pain. You know why? Because I don't know you. Me and you know they discuss like consultation. Now just waiting you talk here and we can't make diagnosis. So commonly, waiting they cause waist pain commonly for people now age. Most people they get waist pain or the kind of job where they do or their weights. You understand? Commonly, though other things they some people get arthritis of the spine. But your abdominal pain, I don't fit tell you waiting the cause am because I don't know anything about your pain. And that is why I tell people on my page. For those where they watch me for the very first time, say always speak with your doctor so that they will try find out. There's no way we can treat you online here, unless now private consultation. So I go advise you: do not take any antibiotics again, and try to speak with your doctor. So I made them check you, examine your belly, examine you, check your back, and then tell you what they call them. If you go need to do tests, they will tell you. Do you understand? Okay. I have shared. Chizobam shared. Thank you for sharing. The rest people, una know they share. Make una show love, show love, show love. How? Share, like, and then you can send stars. Yes. Okay. Mercy, Ive Gloria Joe, I see you. Please, I want to know if hernia is being controlled at an early stage. Will it heal completely? Controlled? What do you mean by controlled at an early stage? I don't understand that. I don't know what you mean by controlled. I see the treatment for hernia, na surgery, operation. Unless no be hernia. But if hey God, this network don't start again. I don't tire. Ladies and gentlemen, I don't tire for this rubbish going on. Shana, they see waiting at the sofa. And now they see how they suffer. So if you get hernia, now surgery, now operation, I don't tell you, not allow anybody to lie to you. You can go to your doctor at the hospital, they will confirm them to you. If not hernia, but if not be hernia, maybe. But I don't know. But if not hernia, true, they will need to operate them. Having sex regularly can bring problem to human system. Is that your question? There's a video, Femi Stone. I made a video about this. Is on the benefit of. Yeah, I don't want to mention it again because of the algorithm. So you get benefits if you do them irregularly. Maybe you might feel tired, or your partner might feel tired. So we advise you, may you give your body normal break. You understand? But normally, you're not supposed to give you any problem. Do you understand? You get benefits. So go to that video where I make on the benefit of knacking. Watch the video. You will see the benefits there. Yeah. Keep sharing the live. Good evening. When exactly is a newborn mother to start ovulating? Your name is Ajay Sumobi Oluwatoyin Adewale. Okay. It differs for different women. Different women, it differs. You can't really pinpoint that this is the exact time. For some women, after they born, after they give birth, the next month, she will start to ovulate, meaning that she will get belly again. You understand? I believe you don't see woman wey born pikin, she dey take care of newborn baby. After 3, 4, 5 months, she get belly again, meaning that she don't ovulate. Some other women, they go born pikin, they no go ovulate. It will take them a long time because of their body breastfeeding. So then there is no specific time. Say this woman don't born pikin. No, now in the next 2 months you go to ovulate. It differs. So it's not gonna advise you. Try to watch my video where I make on the signs of ovulation, because ovulation get different signs, and you fit take note of those signs. Maybe your body will tell you, say, bless I don't ovulate. You understand? And I don't make so many videos for this page, but sometimes it be like to say we they waste our time because people not really they watch them. Yeah, so please try and watch that video. Yeah. Chinanu from Cotonou, Prince Chinanu. I see Chinanu Alpha, Jessica Ngozi. I have shared too. Thank you. I've shared. Thank you for sharing. Kenneth, thank you for sharing. Chioma, thank you for sharing to 12 people. What is the cause of lower back pain and heartburn days after period? Gloria, okay. Be like say you know start with us from the beginning. I talk about back pain before. Back pain. Many things they. But you notice that some women, when they on their period, some women they feel get back pain because of the cramp. If you give them back pain. So if your own back pain now only when you date on your period, or immediately you finish your period, now you get your back pain every time. I'm using the word every time. Your period come, as they finish, they get back pain after it go disappear, and then now your period they cause them. But if you know, say they get back pain, and this back pain, they near period, it go just come on its own, go waka, disappear, and then something else they cause them. Gloria, does that help? Faustina Beke, Faustina, how are you? Dr. Israel is here. So we have a comment here. Dr. Israel is in the house. Dr. Israel, Alpha, how you doing?
I'm fine though. Good evening, everyone. Happy Sunday.
Yeah. Happy Sunday. Welcome. Thank God say you don't come. So today now question and answer, and I have been taking some questions. So Moko just continue from where I stopped. This person says Ever since I grew up, I have always noticed that my urine comes out in multiple streams whenever I am urinating. Please, is it normal? Dr. Israel, help us.
Okay, when your urine they come out in multiple stream, I believe it's a male, and sometimes it can be the issue of circumcision. So if you are not well circumcised, something like that will they happen. Means that they not open and then they not do the circumcision very well. So that can happen. Another thing that can actually cause it is when the person doesn't get infection in the past and the infection come here, it can lead to restriction. When that restriction they maybe at close to the tip of the uh, of the of the penis of the urethra, if it they cause that also multiple stream of urine. So those are some other things. Those are some of the things when you feel cause that. And some for some other people, maybe the way you say they arrange yourself when urinating may also lead to that. But most of the time is maybe the circumcision was not done very properly, or maybe you first get infection when in the past, which will be one cause restriction.
Okay. Yeah, so you don't hear Dr. Israel answer. Let's go to the next one. But before we continue, if you just they come, you did welcome. Today now question and answer we they do. And for new people when they come to this page, you did welcome. We know they prescribe medicine, we know they treat no vex. Now only advice, we just advise you. We know they give medicine on social media to treat people. And then finally, don't forget to send stars. And nobody want to send this page star again. Why? On Facebook and YouTube. Why? Okay. Doctor, I wake up 4 o'clock now. Is it normal? I find it difficult to sleep. Do I have a problem?
When we talk sleeping, we say the normal sleep for at least if you don't get up to 6 hours sleep, you are good to go for the day. So if maybe when you calculate when you take sleep, when you take up to your bed, and when you take wake up by that 4 o'clock is up to 6 hours, or based on where you see they stay, at least 6 hours, you are good to go for the day. Yeah, some people because of the kind of work when they do and because their body don't prime to their environment, some people feel not they sleep on time, while some people even when they sleep on time, they wake up on time. So remember those times when you did school, you they read into the night, when you sleep and you see the quick wake up, it gets some time your body go they used to run. So it's just the same thing with this one that you are waking 4 o'clock. Maybe your body don't they used to run, but just try and know, say yes, you are actually sleeping your normal at least 5 to 6 hours every day. And my brother, you are good to go.
Okay, thank you. Let's go to the next one. This one says, Doctor, please, is it right to eat fruits before or after eating?
Actually, there's no fast rule about that. Anytime you feel like eating fruit, you can eat fruit. You want to eat it before you eat normal food, no problem. You want to eat it after you eat normal food, no problem. Most of the time, we always say eat orange after you eat normal food. It's not because you get one thing we go do if you eat after. It's just that orange go actually speed up your digestion and make when you go toilet sorry, you go make sure say it speed up digestion. And another thing is that during it go make you want quickly go toilet, and with that it go make your stomach quick dey empty. So that's the reason why that's why some people try to eat fruit after food. But there's no any literature that really say yes, you must eat food before orange. And so anyone when your body tell you, anyone you feel like doing, you are free to do it. Not get any problem.
Yeah. That's just the answer. I know why you are asking because many people they tell you different things online. Take your fruits 30 minutes before eating, take this and this. Please, I beg you. Please, let's not make our life complicated. Our goal be say you chop your fruits. You understand? If you like them before you eat your food, fine. If you take them after you eat your food, fine. Whichever way you go aid digestion. Some people won't when they go detailed into chemical reaction, the acid, digestion, and the rest. But for you, we will just tell you ensure say you they take your fruits. Okay, we have a question here. It says, doctor, please, what causes frequent heartburn? From Azubike.
Okay, heartburn. Most of the really cause of heartburn is just, the stomach get acid when it did the stomach, hydrochloric acid, and it is very acidic. So sometimes the acid go come overproduce, you can't go up to the one what we call gullet, the esophagus, and because the layer the layer wey dey the esophagus not be the same with the layer wey dey the stomach, e go come make there dey burn somehow. Na dey give us those heartburn. So there are so many things wey fit trigger that kind of reaction for person body, and to go reach the food wey some people dey eat, and some kind of food you eat can trigger that. Your carbonated drink can trigger that. Even some drugs that you take can also trigger that. So whenever you notice, say you eat some kind of food, take some drinks and all that spicy things, and you notice all those kind of heartburn, the good thing, the best thing to do for yourself is to either stop those things or you reduce the intake of those things. And also, when you try to take a lot of water, it will still help you to reduce those kind of heartburn.
Yeah, thank you, Dr. Israel. So, if you never share the live session, please share. Let's go to the next question here. This one, I've been answering before. How do I know if I'm ovulating? Okay, there's a video on my page about ovulation, the signs of ovulation, madam. But make I allow Dr. Israel answer you.
As far as you say you don't answer, I don't think there's many things to say. Okay, I think many people don't ask us this particular question. So most of the time there are some signs and symptoms that can go with ovulation. However, it doesn't mean that when you see those signs and symptoms, it means say yes, now you don't ovulate. So sometimes those signs and symptoms can come even before the ovulation. Yeah. So one of the signs that will come, the person may have increased temperature. That na one. The another one, that is when we say increased temperature, not me say the sick, but body can be very hot, warm than its previous. Then another one I will say if they get pain, abdominal pain, for one side of the stomach, mostly the side when the egg will want from drop. Sometimes this month if you get that for left, the next cycle if you get them for right. It just only tell you where the egg want for drop. Another one I will say some people feel just they really feverish. Some people may be very feverish. So, but even when you not take anything, it just well off like that. And you should know that all these symptoms they happen for just one day. That stomach pain na just one day, not be say na 2 days, 3 days. No, na just one day. That within 124 hours, now you feel, now the person go feel those things. Another one for most women, their libido as at that time go come high. That is, it be like when we say goats, they heat period. So as at that time, they are like in their period where they need man to come meet them. They need that touch of a man to on them. So another thing when the woman go see that for their vagina, normally that they get normal discharge. During that time, the discharge go they very tiny and slippery. Most of the time, if it be say go they very slippery. Yeah, that means that very slippery and fine discharge, tiny like that. So when you start to see all those ones, you know, so okay, ovulation time nowadays. So and so that one of the things when you go fit. Those are some few things when you fit in know when you they see your ovulation. Why for some people they may not have anything, but if you can always check that your mucus sign, you will always know when you are ovulating or not. Yeah.
Okay. Next question says, now network. Having a feeling of fullness, heaviness, or pain in the pelvic area. What Okay, I think you are asking, what is the cause of feeling of fullness, heaviness, or pain in the pelvic area? So Israel.
Okay. So I feel you say many things fit cause am. Sometimes nothing fit cause am. It just be your feeling. If you be saying your mind just dey tell you say those things they happen. Another thing when fit cause am, if you get any waist pain, any kind of waist pain, maybe na trauma or anything, you feel those kind of fullness. Also, if you they gather urine, and they gather urine, you can also feel those fullness, even pain at your pelvic area. Eh? So and then well, I know say person go dey wait make I talk say infection fit cause am. Well, it's possible and that can also cause it. So if you are pregnant also when the pikin don big for belle and don dey near say you wan give birth, you fit still get those kind of fullness for your pelvic region. So many things as I earlier said, many things fit cause am. So it's just for you to go to the hospital, try to explain to your doctor how you dey feel. So they may want to do 1 or 2 investigation for you, and whatever they see, then they will treat you based on what they saw.
Okay, this question says, what if the woman is not breastfeeding? Like me, I lost my child after birth. So sorry, Oluwatoyin. So I'm trying to know when I can get pregnant again. So Dr. Israel, this question is the second part. The first one was, when should a woman or when would a woman ovulate after giving birth? And my response was, there is no specific time. You understand? It differs for so some people they see affect. So now the response be this: the woman is not breastfeeding. So when should she um get pregnant again? So respond.
Yeah, and actually, most of the time for women wey no dey see menses ovulate during and delivering breastfeeding, actually it's the breastfeeding that actually stop that ovulation and menstruation. So as far you are not breastfeeding, you are not menstruating, and sorry, as far you are not breastfeeding, as far you are not breastfeeding, and maybe they give you some medication so that the breast milk no go come out again. As far as those ones don't happen, as soon as possible, you start you ovulate again. So even for women when even born, most of women wey even born dey breastfeed sef, within 2 months some of them don start to dey see their menses again. Simply mean that they don already start to dey ovulate again. So if you no come breastfeed, first of all, sorry for your loss. So if you wey no come breastfeed because you lost your child, it means that as soon as possible you can actually start seeing your menses, and your ovulation go start. So there's not a specific time. We're not tell you say now 2 months, now 3 months. No, there's no specific time. So, but when they give you medication to actually stop the breast milk flowing. Hello, you just hear me?
Yes.
Dr. Fred. Okay, so
Yes.
yes, they are supposed to, when your doctor give you any medication to actually stop that your breast milk from coming out and all that, it simply means say they try to prepare you for your next pregnancy. However, when you once you don't see your menses for the first time, I think you should still go and meet your gynecologist so that they will prep you as far as you really need pregnancy. They should start preparing you for the next pregnancy, because we never can tell why what causes the loss of your child. Let me assume that now as you give birth the pikin there. Let me assume. So we never can tell what really causes the loss of your child. So if they start to prepare you so that such occurrence not go take place again.
Yeah. Please, if you never share the live session, I bet share and click on the like this live session. Like them and share. Like that, you support us. Okay. Doctor, I would like you to make a video about circumcision for women, because I did it and it caused me problem in my marriage. Jessica, so sorry. Can you please, if you don't mind, tell us in the comment section which problem it give you? So make I respond quickly and then I'll go hand over to Dr. Israel. Number one, there is nothing like female circumcision. It is very bad. It is wickedness. It is criminal, and it must never be encouraged. But some of our mamas, our fathers, elders, believe say they must circumcise woman. But that thing they very bad. It don't spoil many women life because when they cut them, they get so many problems. And we don't try to talk about them before. But maybe as you ask us this question right now, inside this part of this discussion, we go try extract again and just put it out there. So, Dr. Israel, let's just talk about this thing briefly again, and then maybe we can extract few part from here. Yeah.
Okay. Actually, I think we've talked about female genital mutilation like 2 times now, if I'm not mistaken, like up to 2 times now. That's what when we don't really make video on this. As Dr. Fred talked, there's nothing like female circumcision. It is actually called female genital mutilation. It's a mutilation. It means say you they cause problem, you they do criminal act. And yes, these ones they are harmful traditional practice when our forefather or our parents practice those days. Maybe because they don't really know the effect of what they do. But now we don't know, and we try to tell people, make them for know and make them for not practice, and it is not a good thing. Even it's even in the law that when they catch anybody doing it, the person will go in for it. Now, what it make them they really they do and then they believe say they make sure say the woman not they promiscuous. It means say so that make the woman not they go follow men up and down. But that not be truth. That's a big lie. It doesn't help in any of that way at all. So there are 4 types of female genital mutilation, 4 ways when they say they do female genital mutilation. The one where they quick do for Nigeria or for Africa most of the time is the number 1 and number 2, mostly for Nigeria, the number 1 and the number 2. And what will be the number 1? It means say the clitoris for the vagina. The clitoris now be the most sensitive part of the female vagina, and women now that part now they make woman they enjoy sex pass. So now that part they make women they enjoy sex pass. So when what they do is that they will cut half of that clitoris come out. So when they cut half of the clitoris come out and the inside of the okay, we get what they call the major the major labia and the minor labia. So they will cut the minor labia come out and cut the clitoris, half of the clitoris come out. So that one is number 1. What did they do as number 1? They are believe, as I said, now to make sure say the woman not the promiscuous. Imagine say you don't cut wetin they make woman enjoy sex come out. And you tell her may go they have sex. So the woman will always be having sex up and down and trying to look for satisfaction, trying to look for what you go make her enjoy sex, because you don't remove what you supposed make her enjoy sex. So you can see that instead of found to even they correct the promiscuity, it even make some women enter that line. Then the number 2 for the number 2 for the number 2 of the second type for this for female genital mutilation, I will say that they remove the full clitoris and then they will now cut the inside of the major labia after they don't remove the minor labia. Then they will now put them together and make it heal together. So at the process of putting it together, you know, when you get 2 places where they open, you can't put them together, they go gum together. So that's another thing when they do to women, because when you don't gum and finish, you can't make the vagina hole. They're very tiny. So they will only just leave space for where menses go they pass, they come out. So when that kind of thing don't happen, if mistakenly say they want go meet man, the thing will they pain them. So because of that pain, they go they run from men. So that's what they think, that they protect them, may they not they follow men. But it's not true, because in the long run, it will cause problem for the woman for marriage, during marriage. So when they do that, the man not go fit enter, so it causes pain during sex. So the woman not want to have sex. So number 3 is that they go remove the full Number three is that they go use something to pierce every part of the major labia, the clitoris, pierce and chuku everything, so that make it not be like normal vagina again. Then why the fourth one, I be say they go pour any corrosive substance, like chemical, anything where they corrosive that can cause injury to that place. So when they cause injury, their main aim is to make sure that they fit close the vagina, so that the vagina will be very tiny and it can actually cause pain. And one thing is that there can be injury, there can be infections, there can be bleeding, and even death can even follow that place. So when they don't do all these things, they let the woman go, then the problem begins. And one of the problems, as we earlier said, is injury, and to both the male and the female. It even leads to penis fracture. So when, because no space, the man they try to force enter, the penis will fracture. And the process of also trying to force enter, if it cause tear for the woman again, and when that tear happen, bleeding will follow, and that place will heal again and go back to that normal small distance, because ego because ego because ego because ego make the whole of the vagina to become very small. So when the whole of the vagina become very small, then another problem don't start. Yeah, I think I'll stop there for
Okay.
now. Dr. Fred,
Okay.
do you have any other thing?
So I see your comment. It says, I don't feel like a woman in with my husband, even if he's in the mood. I'm not. As I'm talking to you, more than a year, I've not been with my husband. So sorry, madam. So sorry about this. Final advice we will give you on this: try to see a gynecologist. See a gynecologist, make them assess you and find out how they go fit take help you in
Okay.
no,
And Dr. Fred,
circumcision. There is nothing like female circumcision. It is bad, it is criminal, and it must never ever be encouraged. Anybody way do them and then catch them, that person go enter jail. So make we stop them. Thank you for your question. So let's go to the next one.
okay, sorry, before I stop, based on our comment, not be only gynecologist you need to see, you also need to see a psychologist, and they need to prime our brain back to normal. Yeah. Now, one thing I think that caused that for her is because of the pain she must have passed through in the past. And person don't pass through pain, serious pain. If you tell her may do that thing again, you know one. It's normal. So I think that would have been it. So you need a psychology also to prime her back.
Yeah.
Yeah.
I feel the gynecologist go know how to refer them and it go easier from there. Yes. Other than her. Yeah. Yes. Okay. I've done all that. You have done all that. I just saw your comments on my other device. You have done all that. Wow. So sorry. So sorry about this. Maybe we'll have another discussion on this again. You understand? Yeah. Okay, quickly, because of time, so many questions. Doctor, please, how long does it take H. pylori to heal? Dr. Israel, quickly, time.
Okay, H. pylori, it really do not have a specific time, but most of the time we treat it for up to 6 weeks. You take your medication, your antibiotics, your proton pump inhibitor, you take it for up to 6 weeks. So when you don't take them for that 6 weeks, then you feel they continue your drug gradually, and before you know whether it don't heal. So most of the time the bacteria fit don't die come out within that 6 weeks, but wetin it don't cost fit remain. The ulcer when don't happen fit remain. So that makes sometimes when you think say person don't treat ulcer, if they come back. It just be like place where it wound. If you go put something for that place, when you never heal finish, it go the injury go come out again and go resurface. No say now the intestine, the intestine, stomach or the esophagus now they injured. So when you keep on eating, the foods they brush those places, and you go they cause the pain, the refreshing of the wound again. So that makes sometimes they take a very long time for it to be treated.
Okay, because of time, can malaria and typhoid cause someone to have difficulty in breathing?
Okay, first thing first is that if you get typhoid, you go to hospital already. So all those things when they call malaria and typhoid, most of the time you don't have typhoid. Now only malaria now you get. So yeah, malaria can come with a lot of different symptoms. A severe malaria can actually lead to difficulty in breathing, because mostly for children, because by then they can get anemic heart failure. So when they get anemic heart failure, they get this difficulty in breathing. However, when you don't notice difficulty in breathing, your body they hot, most of the time now broken pneumonia now go actually give you that broken pneumonia, and you'll be surprised that you go the cough as well. If you really want to know the symptoms, if you really want to follow up, you'll notice that you they cough, your body they hot, and they get that difficulty in breathing, and you are very weak. So not be malaria you get, not be typhoid you get. Most likely it might just be broken pneumonia or anything related to respiratory tract, respiratory infection. So you need to go to the hospital for proper checkup.
Please, doctor, I removed my implant since February and have not been able to conceive till now. Is it normal?
Okay, that's like 5 months ago. That's when you remove your implant. Yeah, your body need to go back to the normal stethoscope again before you be thinking of pregnancy. However, everybody body they different. You feel just remove them today, your body will prime itself within 1 month, and you become pregnant again. But it not be like that for everybody. So if your body say, okay, let's take it gradually, one step at a time. So you need to follow your body to take it one step at a time. But the next thing I will tell you is that you also need to visit a gynecologist, so which will actually guide you through that one step at a time, so that when the time for pregnancy reach, you go quickly get the belly. So it's not like it's bad. It's not a bad thing that by now you are not still pregnant. It's not really bad, but you need to just keep yourself going. Before you know it, they happen, it go enter. Also, you must know your cycle very well if you are ovulating and all that. Because if you don't know your cycle very well, and maybe you dey ovulate and you not dey have sex regularly as you suppose, you fit not still get better, even though gynecologists and everybody do everything for you.
Okay. Doctor, what can cause, I think this is rashes, right? What can cause rashes in the body? Hopefully this is rashes. Or can HIV person have serious, I'm hoping this is rash in the body. Okay, let's talk about this quickly. Call of time.
I guess it's rash.
Yeah.
Okay, yes, HIV person can have serious rash in their body, but it doesn't mean that okay, when you see rash in anybody's body, whether it's serious or not, it not be 100% say that person get HIV. Even though yes, people with HIV, majority of some of them may come down with rashes for their body, their leg, their hand. It may be severe or not. But when you start to see rash for their body, when you start to see rash for body, most of the time it can be fungal infection, can be because of drugs, can be bacterial infection. So that one at the time to go see a dermatologist. And with seeing the dermatologist, then they will know what next to do. So also you can actually say, because of these rashes that you are seeing in your body, and because maybe the person they fall sick quick, if you decide to do HIV test, and anything can happen. If not HIV, that really cause the rash on the body. Once you start the treatment, the rashes go disappear.
See questions now. Wow, doctor, good evening. Wetin dey make eyes they shake? Is it shortage of blood or low sugar in the blood? From Adedayo and Diwali.
Okay, I think I don't really know as I want to answer this thing, but sometimes I don't think you have problem with any of those two. You not get problem with your blood. It not be because of shortage of blood, and not be because of low sugar. Per se, I feel shake. Sometimes for some people they happen normally. You just shake for some time and stops. Not be saying that something when they continue, they continue. I believe it's the eyelid he's talking about. So you just shake for some time and stop. It not be continuous thing. So if it happen like that once a while, I don't think you should be afraid. You should not think of anything, nothing serious, and nothing really.
Okay. We have a question here. Hello, doctor. I saw my period on the 9th of this month, and on the 21st of this month, I see it again. No continuation. I don't know. So, Dr. Israel, just drop one or two with regards to this comment.
Okay, first thing first, you want to count that 9th when you say you see a 9, you first 9 start or na that day stop. So if na that day stop, that's not your first day of menstruation. You need to go to the first day when you start. Now that one be the date when you take. So you want to find out from that first day when you start till now when you say you dey receive am, how many days. If it's up to 24 days or 25 days, is normal. Another thing is that this 21st when you say you see am again, is today's 24. So
Third.
most likely maybe you, okay, 23rd. Most likely maybe you still dey see am. Want to find out, is it that it continue or it just come at that 21st and it stop? That another thing. Because if you come at only that 21st and it stop, it means it not be menses you see. You need to think of something else. But if it continue come out and it's doing like your menses, most of the time we still don't need to trouble ourselves. We want to wait till next time when you want to see menses if something like this will take place. But you will also ask you whether you take some medications, because there are some drugs that can make you see your menses like this. If you go take some contraceptive, it can actually cause this. Also, if you're on any contraceptive, you can also be having something like this. And so those are a few things, few questions we need to ask. But as I earlier said, if you know the first time when you really see the menses, if it's that, to when you see them again, if it's up to 24 days, 25 days, don't worry yourself.
So I saw her comments here, and she's saying, I have 6 days cycle. I'm sorry, Olayinka, your cycle cannot be 6 days. You are getting it wrong. I'm seeing her comment from my other device here. So you would have to go find out what is the length of your menstrual cycle. Menstrual cycle can never be 6 days. It's from 21 to 35, like what Dr. Israel told you.
Now, should they miss some menstrual flow? Days for menstrual flow is different from cycle. Cycle is the beginning of one menses to the return of another menses. That is, when you first see the menses, from there to when it can come back again, and that one be cycle. So your menstrual period, maybe 3 days, 4 days, that one a menstrual period. That will not be your cycle. Yeah, so
menstrual flow, yeah.
You also have to get
okay.
that right.
Okay, so many questions. YouTube. Hello. Good afternoon. Oh my God. Please, I used to pee too much in the night. I don't know why. And you said too much of pee in the night is called what? Angel Pretty, Dr. Israel. Okay, please respond quickly. So many questions full here.
Okay, too much of pee in the night is called,
Nocturia.
Okay.
The medical name is called nocturia. If you pee for night,
Nocturia, yeah.
Nocturia.
Yes. The reason why they laugh, because I'm trying to they tried not to say some things, so I just laugh them out. Okay. If you pee always in the night, we want to find out first of all, you drink water many times in the night. Because if you drink a lot of water at night, there's every tendency to say you go piss well for night. If you drink water well for night, you go actually piss well for night. So it will not be a problem with that. So another thing is that when you piss, any pain, you have waist pain, and you dey feel your urine. So we need to ask you some other questions before we go even fit know if there is a problem or not. Now, if maybe there is no pain, you dey feel your urine, you no get issue urinating, the urine dey normal, everything, e fit be normal. Then another thing wey fit cause those men urinating well well, another thing fit be say you get a lot of sugar for your blood system. So then you will now need to go and do blood sugar. That's your fasting blood sugar and all that. So if you do all those things and they are normal, my person, I don't think you should be afraid of anything. You will just be okay.
Okay, thank you. We have 10 minutes more. I beg, share the live. People share. Support us by sharing. At least this one, they know they collect money from anybody. Okay, doctor, in those days, I learned that if you drink water before eating, you will be filled up. Is it true?
Well, you learned it. Did you practicalize it? If you practicalize it and it really happened like that too, you would have answered your question by yourself. So that is it. And the thing is that when you drink water before you eat, doesn't really yes, it actually takes some space from your stomach, but doesn't really stop you from eating as you want to eat. You may not eat too much, but at least you have eaten something, and your body will be very glad with you.
Okay, time don't they go. Is it possible for someone to see menstruation without ovulating? Also, can infection stop a lady from being pregnant?
Okay, yes, you can see your menses without ovulation. Some persons when they on contraceptive, yeah, some of them can be seeing their menses and they are not ovulating. And some other conditions, there are some conditions that can also cause it, that will make the person and they call this thing now.
Anovulatory cycle.
Yes, anovulating cycle. So some persons they will get on like that. Some condition can actually cause it. Yeah, also infection can actually prevent pregnancy. People with chronic PI.
Okay, wetin happened to Dr. Israel? Dr. Israel, your network, join us again. So Mark, continue. Yes, infection fit cause one of them, one infection. Another one fit cause now weight loss, severe weight loss, hormonal issues, problems with the woman uterus. Also, if it be from the man, so make you not just put eyes now from the woman. So there are many things if you make a woman no get belly. If it be from the ovary, from the uterus, from the hormones, from the tube. If it also be from the man, you understand. So there are many things we go make a woman no fit born or carry belly. Let's use that word, carry belly. You understand? Okay, Dr. Israel, network is bad. Are you back? Dr. Israel, his network is still poor. We can't seem to get that. Okay. We have our time is almost up tonight. 6 minutes more. Doctor, how women can prevent pelvic inflammatory disease? Okay, this is a very good question. To prevent PID, number one, very, very important, hygiene. The woman, as a woman, you need good hygiene. Number one. Number two, whenever you meet your partner, ensure that you they clean up very well. Number three, after meeting your partner, ensure say you go urinate. The next one, ensure say you know get multiple partners. The next one, ensure say you know they put chemicals. You know some women go tell you say they want make that place they smell nice. The area of the V, I don't want to mention the word. They will come go buy so many things they apply inside that place. Those things where they apply, if it cause you problems, if it change that environment, if it can make microorganisms grow well. Now, when the microorganisms grow well, they if move enter. Again, another thing again where you go need to do be say try not to dey store urine, because some women they sabi like to dey store urine. You understand? So basically these ones fee help you again. And no, they abuse antibiotics. Some ladies just believe, say, whenever belly pain them, they will go buy ampiclos and flagyl. Now, by the time they can't really need that medication for their body, it no go work again because they don't abuse them. They don't get antibiotic resistance. So, as a woman and as a man here, no just believe, say, you be doctor. You know be doctor. Unless you go for training, you go to medical school and train you. So, no, they put antibiotics into your mouth anyhow because if it give you problem, and some women, they suffer from this problem because my then use their hand enter there. So before you take any medication whatsoever, it's important you speak with a medical professional. And again, antibiotics. Okay. We have a few more minutes. We have a question here from Ivie Ehis. Hey. How infection causes infertility? So Ehis, quickly, because of time. There are many causes of infertility. Infertility means the inability of a couple, a man and a woman, a couple, a man and a woman, the inability of a couple to achieve pregnancy after 1 year of regular unprotected intercourse. You understand? Basically. Now, there are many causes. It can be from the man and it can be from the woman. One of them could be from infection. Infection will block the tubes. You understand? When you block the tubes, you know if you make egg pass. So that is just one. There are so many other causes. So if you want to know more about infertility, I would advise you go through the page. We don't make videos. We don't do session like this with experts on infertility. Because of time, Dr. Israel, this person says, please,
Yeah.
how true is it that evacuation after a miscarriage causes delay in conception?
Well, evacuation after miscarriage does not actually cause delay in pregnancy. She is pregnancy, yeah. It does not actually delay it. It's the procedure, how it was done, that may make it cause delay. If the person who is doing not really doing well, yes, there can be delay. Or if it to go script, there can be delay. But it's not because of not be saying that the procedure cause now because of the person who is doing. Then also, if your hormone never see prepare itself complete, the person may not also be get pregnant.
Okay, we are almost out of time. This question says, good evening, doctor. Is low blood pressure as deadly as high blood pressure? Cup time.
Low blood pressure is dead. It's not, and when we say deadly as, there are two. We know they compare there are two. Somebody get high blood pressure, we even think it's better than the person get low blood pressure. But once you get low blood pressure, you are going. But once the person get high blood pressure, we can control it and bring it to normal, all that. Yeah. So it is not good to have.
Okay. Dr. Israel, your network. I don't know. It's not good to have a low blood pressure, if that is what Dr. Israel was trying to say. We know they compare the two of them. If it's high, we can bring it down. But when it's low, it's not a good sign. Which I go add to this be say, try to see a medical professional. No make a diagnosis of low blood pressure on your own, because some people actually get low blood pressure and it's day normal for them. So try to be careful in making that diagnosis. Allow a medical doctor arrive at that diagnosis for you, because I don't see a lot of people who could tell say I get low blood pressure, but they are fine. So you should ensure that now a medical doctor now confirm them. And if indeed you get low blood pressure, they will tell you what to do. Yes, it dey happen, but it's not that common. This question, okay, are you here? Doctor, please, having sex regularly, is it bad for the system? It's not like it's not bad for the system. The only thing that can happen to you is that you can burn yourself out, you can make yourself get unnecessarily tired. So the advice now make you use your sense. Good life now waiting, now sense. Use your sense, you and your partner, so that at least you can do your normal stuff. But continuously, they always do you burn yourself out. And we know say intercourse gets some benefits. The video also did this page, so try to watch the video when you see the benefits. Let's see if we can take one or two more and then we are done. Doctor, can fibroid stop menstruation and can the person get pregnant? Fibroid will not stop your menstruation, and yes, a woman that have fibroid can still get pregnant. Yes. This thing we they ask us again, we don't discuss fibroid tire well. Fibroid no go stop menstruation. Woman if you get fibroid, she go born all her pikin, nothing go do am. Some other women go get fibroid, it go affect. Depends on so many factors. So no be say fibroid they stop woman from getting pregnant, but it depends on the size, where the fibroid dey, and many other things. 9 feet affect. But generally, so many women get belle, they don't born and then get fibroid and they are living their life. It never even disturb them. Is that okay? Last question. So Israel's network is okay. This one says, doctor, what causes frequent mouth ulcers? As we round up, frequent mouth ulcers. One thing could be stress, another one could be immunosuppression. Severe forms of stress, immunosuppression, malnutrition because that certain medications, chemotherapy because mouth ulcers. So basically, nine be that severe forms of stress, immunosuppression, nutritional deficiencies can cause that. So thank you, ladies and gentlemen. Whenever we do this kind of thing, people know will come, watch, and learn. We will beg, make una help us. How? Share this video, invite your friends. That way you're supporting them. And then we'll also encourage you to see your doctor if in case you get any medical challenge. We don't take all the questions. We are done with. Okay, we are done with all the questions. There's a last one here, so make I give Dr. Israel. Make I just ask Dr. Israel. Dr. Israel, this person just they come. We start by 8 o'clock. Oh, no, they come late. Doctor, please, drinking water early in the morning, is it before you brush or after brushing? Mentus. Dr. Israel, please respond. Hey, God, your network again. Voila.
You dey hear me?
Now I dey hear you. Oh yeah, let's go.
Okay, so what was the question again?
Drinking water early in the morning, is it before brushing or after brushing?
Okay, normally, you're supposed to brush 2 times a day. And that's normal. You're supposed to brush 2 times a day, in the morning and in the evening. So that when you wake up in the morning, the first thing you do is to rinse your mouth. After rinsing your mouth, then you drink water. You drink water. So now, so it's supposed to be. So I don't need to talk anything more than that.
Yeah. Now, so it's supposed to be. But for some people must brush before they drink. Some people go just say, I can't take anything without brushing. Some go drink the water even before brushing. You understand? Why for some, they go rinse their mouth before taking the water. But the truth is that anyone you do, no one will give you sickness. Really. It's not that, like the colleague said, you brush your mouth in the evening before you go to bed, you wake up in the morning and still that same mouth. So nobody say it will give you any problem for your body. Now just the one where you get comfortable with. Now it will help you. Okay. Thank you, everybody. Dr. Israel, any final words as we round up tonight?
Okay. Good night to everybody. Good night to everybody, and God bless you guys. Won't until they follow us. I want until they listen to our program every Sunday by 8 p.m. We not take una for granted. We say una do well. Won't until they listen to us. Also, make una try to keep safe as everywhere for mostly those who in Nigeria. We know say everywhere they had the joiner, but let's just try and keep safe and keep our head down.
Yeah, thank you, everybody. Thank you, Dr. Israel. For those who they do the fruit challenge, thank you for joining the fruit challenge. We continue our fruit challenge tomorrow. Today now day 7, 1 week. So we continue the fruit challenge tomorrow. Like I always tell you, good life now waiting.
Nonsense.
Good life in a sense. Take care, everybody, and have a wonderful evening. Bye bye.
Good night.